أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Assalamu alaikum warahmatullahi wabarakatuh. How are you, friends? Hope you're all fine. And today we are going to discuss the issues and difficulties that the nursing industries face. The industry, the health, the nursing is an important part of the healthcare industry in Pakistan, in any country, in anywhere in the world. And today we are going to discuss what are the difficulties and issues that nurses are facing in Pakistan. We actually had a session in Urdu language a few days ago, and right now we are going to discuss all of that in English language so we can convey our message to more people in not only for in Pakistan, but we are also trying to cater to international viewers. For that, I'm going to invite Mah-e-Kamil Hashmi. Assalamu alaikum, Mah-e-Kamil Hashmi. How are you?
Walaikum Assalam. I hope you can hear me.
Yes, your voice is okay. Can you hear my voice? Yes, can you hear me?
Yes, now. It was stuck before.
Okay, that's great. So, we are going to discuss the difficulties and issues that the nursing industry is facing in Pakistan. We had a session on this topic in Urdu language a few days ago, and now we are going to discuss it in English so we can try to convey our message to more viewers. So, how are you doing?
Alhamdulillah, I'm doing well. How are you doing?
Okay, so we are going to discuss. Okay, so let's have a discussion on what are the issues that the nursing industry is facing in Pakistan. So, what do you feel are the issues that nurses have to face in Pakistan, like related to their work, and what are the negatives that the nurses face? Why is there a negative reputation of nurses among patients? Why patients think that nurses are not providing proper medical services?
Okay. Uh, so, first of all, I would like to have a brief introduction of mine. I am Mah-e-Kamil Hashmi and I'm from Islamabad. I am a graduate in nursing and postgraduate in public health, and I'm also pursuing my second post graduation in nursing. I have been doing lectureship from the past 2 years, and during my training, I have seen a lot of circumstances and situations where nurses have to deal with diverse kind of patients and attendants. And coming towards the topic of today, the main challenge of nursing and nurses both is the image of nursing in Pakistan. As I discussed in the Urdu session as well, people are of the view that nurses are only from the lower middle income families or middle income families, or they are from poor families, or nurses are those women who cannot get married, or who have to pay for their families and who have no other thing to do, like they're not eligible to have families, to get married and things like this. So this is the image which nurses face even in these days, in the current situations, in the contemporary setting. Nurses face this issue very commonly. When I did my intermediate in pre-medical, and I was not able to get to the medical college, and I took admission in nursing, in army nursing, I had no idea what I was going into. But after getting into it and getting going into the wards, into the hospitals during my training, I realized that what I have done to myself. Initially, it was, a heartbreak when you are an aspirant to become a doctor and you get to become a nurse, and the people you meet during your training are of the view that doctors are superior and nurses are inferior, and that they might be from the very low background, and things like that were very disturbing in the careership days. However, there were also some nurses who were trying to raise the image of nursing, and because there's always a silver lining in the sky. This is the first and foremost issue which nurses and nursing face in Pakistan, because their image is uh, badly disturbed, badly neglected, badly represented from by the society and even by themselves. Because a few percentage of nurses is not giving a positive image of nursing, because it just shows as if we are not accepting our status quo, and we always behave like we don't have enough knowledge, and we are under the doctors, and we are not that capable to do wonders. However, in foreign countries, this image has been changed a lot. In foreign countries, the nurses' roles have evolved to nurse practitioners, mental health nurses, uh, nurses in the dental clinics as well, in the derma clinics as well. So the image is getting better in foreign countries, and nurses have full autonomy in the foreign countries over their patient and over their responsibilities. But in Pakistan, the situation is not good. Coming towards another challenge which nursing is facing in Pakistan is the brain drain. Brain drain of nurses has become a very common phenomena these days. It is because of many reasons. The first reason being the low salary. In Pakistan, nurses are not offered salaries uh, as much paid by the foreign countries. That is why nurses prefer to move outside their countries, and they prefer countries like Saudi Arabia, Kuwait, Qatar, even UK, depends upon the consultancy and also the interest of nurses. Also, because if nurses are spending their day and nights in with their patients, they demand high salaries, because they have to make both ends meet. um, and in most of the families where there's a female nurse, it is a dilemma that most men are not doing anything and they are just sitting at their homes. um, I'm not blaming the men, but it is a story I have come across many times. The second issue which I am talking about is the brain drain. Nurses are leaving Pakistan very rapidly. Um in one way, it can be beneficial for our country, as nurses moving um outside the countries would bring dollars in return. Whenever they would send money to their families, Pakistan would get dollars, and it would be an economical betterment. But it is a brain drain, and the good nurses are leaving Pakistan. So, which nurses will be left at Pakistan? Who will be there to teach the junior nurses or to teach the incoming generation? So, there is a big dilemma and a big crisis faced by nursing in Pakistan. I would now like to talk about another important aspect of nursing, which is uh, the improper or bad quality of nursing education, which is uh, which is now becoming better in some ways, or in some institutes, I can say. I would like to mention some institutes providing excellent nursing care and also nursing education, like Aga Khan University Hospital, Karachi, and Shifa International University. Uh, both these areas are providing quality care and quality education as well. They are teaching and training nurses to such a good extent that they can develop strong research skills, strong communication skills, and they uh, also are changing the previous mindset of people about nurses. Of course, it's all the communication which change the image of nursing in front of the people. As we have heard that during the hospital stay, most of the attendants and patients are blaming the nurses that they are not good in talking, they misbehave, they are rude, they don't listen to us. It is because of another important issue or challenge, which is uh, the shortage of nursing in Pakistan. And due to the shortage of nurses in Pakistan, the nurses are overburdenized. The remaining nurses are overburdenized and they behave rude. They are like yelling and screaming on the patients and attendants because they are unable to perform according to their requirements, and quality of care is also compromised. So I think I have talked about multiple issues in one go, but actually it's the reality. And whenever I talk about the challenges of nursing or nurses in Pakistan, I can't just stay quiet or talk about some limited things. So I would like you to ask some relevant or some focused questions so that I can answer more focused and clearer. Over to you.
Okay, speaking of the difficulties and issues the nurses have face in Pakistan, and especially the negative response that they are getting, the negative reputation that they have in Pakistan. I have a first-hand experience of that because whenever I have been in hospitals, especially in the government hospitals, nurses are not able to attend all the patients. They are not able to provide complete attention. They are not able to pay complete attention to the patients there, and their behavior is not very polite, as you can say. And I can understand with what you are saying, that they have to attend to patients more than their capacity. Well, first thing that you said was that nurses are migrating to foreign countries due to the low salary, the brain drain issue. What do you think is the proper salary? I mean, what should be an average pay scale? What should be the minimum pay scale for a nurse so that she or he can at least fulfill the basic necessities of life without any worry? They have at least, like a suitable income to feed their family, to fulfill their family expenses.
Okay, thank you. Yes, this is a bit focused question, and I can talk more about on it. Um, as far as the grade or the rank or position um, of the nurses is concerned, if a nurse is having a baccalaureate degree, 16 years education after 4 years education or 4 years bachelor's after uh, intermediate, she or he might get to a 16 scale job. If I talk about government job, and if I talk about a private job, then it depends on the sum he or she is getting, the salary. Um, if the nurse is having a diploma, he or she may be on the grade like between 12 to 14 or 12 to 16. The baccalaureate degree nurse should be having a scale starting from 16 and leading to 21 or 22, and from 18 to 22 being the administrative positions. Um, and if I talk about the private setup, the salaries they provide are not that much, as they should be. The salaries range from like 40K to 80K in private setups. If it is an international hospital and it is having a high number of patients, then it might be providing salaries near to 70-80K to a nurse. And of course, she or he might be having a rich experience. And if she is a fresh nurse, fresh graduate, she might be taking between 40 to 50K. Um and even you will see that there is a disharmony in this as well. For example, some hospitals ask nurses to stay for another shift if there's an emergency, and they don't pay them extra hours. And this leads to less job satisfaction among nurses, and also it leads to attrition. So, if the retention of nurses would not be good, how would the quality uh, care would be given, and how hospitals would work when there is a lot of attrition on part of their organization? So, I would like to mention one hospital here, which is Al Hidmat Razi Hospital, Satellite Town, Rawalpindi, and also the CBR branch. It is basically linked to the Al Hidmat Foundation, and they provide extra wages per hour to their nurses and other employees. So, whenever a nurse has to do an extra duty or extra shift in place of other nurse, he or she gets extra paid. And this is the motivation, and that is why there are nurses available at Al Hidmat Razi Hospital, and they are willing to work, if even if they have to work an extra shift, because they're getting paid. And if I talk about the wages in foreign countries, it is, much higher than Pakistan. In Kuwait, the minimum salary a baccalaureate nurse is getting is about 5 lakh. In Saudi, depending upon the experience, it increases from 6 to 8 lakh, and also the family visa as well. And in Dubai, things also um, are going like this. And one point here is that in Saudi there are less taxes. That is why the salary they get on the pay slip is also the salary they are getting in reality. So but that is why Saudi and other Gulf countries are, you know more preferable for nurses. And also some nurses go to foreign countries on scholarship to study further. And out of those nurses, some come back to this country, to Pakistan, to serve Pakistan and to teach other nurses. But other nurses which are eager to make money, they go, they study more, and they uh, go outside, like UK and places like these, so that they can make more money. And there are many opportunities even in Denmark, there is, and Switzerland, there is a high demand of nurses, and Pakistani nurses are one of them.
Okay. Well, speaking of education, what do you think should be, a suitable education? What should be the minimum, proper education for nurses that they should achieve in Pakistan? Because when we discussed this last time, I told you that I have experienced a lot of nurses who do not have the proper education. They may have obtained a diploma in nursing, but they do not have the proper education. So, what do you think should be the proper education for nurses to achieve, and how much that education can help nurses in performing their uh, daily routine job duties more effectively?
Okay. This is a very, in-depth question which needs to be answered in depth. As far as nurses education is concerned, if a nurse is having a 4 years bachelor's degree, we can say that she has a rich knowledge to continue with the practical thing. But if in clinics like we have in the local streets, we see that there is a male or there is a female, which the people are calling the nurse, or they are calling themselves the nurse, and they don't have the necessary diploma or degree, and they are just inserting the needles into the patients or the catheters, and they are performing the procedures without even knowing the precautionary measures and the infection control procedures. The question that you asked, that what will education do to uh, make the things better? Yes, education means and makes a lot. For example, you study more and you get to know more. um, so these clinics should not be encouraged, and people should not go to clinics like these. They should go to persons who are eligible. And when a nurse gets a 2-year diploma, the Pakistan Nursing Council, which is the accrediting body of nursing in Pakistan, it makes a license for that nurse. And again, when the nurse does the baccalaureate degree, she or he gets the license. And whoever wants to study further, the qualification is being added up on the license. For example, he or she gets the master's degree or the PhD degree. And it is not necessary that if you are doing master's or PhD, you only have to teach the nurses. You can also go for clinical track. You can also go in clinical settings and make amendments in the hospital infection control policies or the standard procedures according to the recommended guidelines of the World Health Organization or any other organization. So yes, a big yes to high quality education. And high quality education or even quality education will lead nurses to do quality care, better quality care. And also it will lead uh, people to be aware that there are more options available. And we should not go to quacks and places like where there are only street clinics open, and they just don't know how to deal with the patient. In this scenario, there should also be public awareness and education. Because if people don't know the uh, benefit of going to a better person who has license, because people have concepts like why should not go to the local clinic when we get the same treatment here, or why should not we go to the local clinic when they take less money. Because the people are opt for low money or low price, they don't choose better persons. So it is also on the part of people that how do they choose licensed people. And I would recommend and encourage nurses to study further, because studying further will lead them to apply the evidence based practice and the research into their practice. So also nurses should make their communication skills better. And um, as soon as they get more education, their communication skills get much better. And um, it is basically in the long run, they will make the image of nursing better in Pakistan. So that an ABC person in any town will be discussing his or her experience with his family, that he went to a hospital, and he had a chance to encounter a nurse, and she was or he was so polite, and they were very happy that they got a good nurse who had good communication skills. So yes, it matters when uh, you start something over. It takes time. Yes, it takes time. It may take a decade or a century, but things take time, and they get better. Are you there?
Uh, Okay, so uh, what do you think? Well, okay, well, last time when we discussed this conversation, there was another thing that you discussed that was about, the issue of female nurses having to attend male patients. And as per Islamic law, it is not, uh, you know, uh, it is not suitable for a female to look after a male patient. There should be male nurses for males and female nurses for females. So, we can maintain the modesty that our religion teaches us. Well, but unfortunately, in Pakistan, there is a lack of male nurses. So you also discussed that issue last time. So what do you think that how can we solve this issue about the lack of male nurses and females having to deal with male patients, or sometimes male nurses having to deal with female patients?
Oh yes, this is a a very debatable question that whether female nurses should attend male patients or male nurses should attend female patients. Here, the main point is that we don't have enough male nurses. In the past, when Florence Nightingale started nursing, there used to be male nurses initially, especially in armed forces. But at that time, when there was World War, they needed more males for war. That is why they added female nurses in nursing, and they took the male nurses to military, to army, to fight. So that was the background, and from that background female nursing started, and female nurses increased in number, as compared to male nurses. And a time came when it was just 80-20 ratio, 80% female nurses and 20% male nurses. And it is literally not acceptable. How can we accept that if we are having, let's assume that we are having 50% male and 50% female population, and we don't have that much male nurses to care for the male patients. In my Urdu session, I shared my experience that whenever was during my training, whenever I was at a male ward, and especially during the night duty, I was disturbed, and I had a thought that why I am here. There should be a male nurse here, and this is a male ward, and all the people are not same, all the fingers are not equal, and I had multiple thoughts. So it might happen with every young female nurse who is gaining her training, and even after that, during practice. As you mentioned that in Islam it is not allowed, it is not allowed for a female to touch a male or for a male to touch a female, even in extreme cases. So there is a dire need of male nurses in Pakistan, although the things are becoming better. But even if I talk about the percentage, in Punjab, there are nursing colleges, almost let's take 20, and out of those 20 nursing colleges, only two are taking male nurses and all other are taking female nurses. So if we are having 1,000 seats of 1,000 total seats of nurses, and out of them 800 are female nurses and 200 are male nurses, then this is again the 80-20 ratio. So how could we expect that if I am sending my daughter to a hospital as a female nurse, and he has to take care of a male patient, and how can I ensure her safety? I'm not blaming anyone, but reality is reality, and we have to accept the uncertain things as well. So policy needs to be changed, and there should be an increased number of male nursing colleges, so that male nurses are produced. And especially, even if we say that female nurses are available to male patients during daytimes, it should not be the case that female nurses are caring for the male patients during the night shift. It just does not feel normal. It feels insane in my thinking. So it is happening, and we should look into it. The policymakers should look into it. I know it would take time, it would take years, but it should be looked upon, because ultimately we have to make a society which will follow the cultural and religious traditions, and which will be safe for everyone.
Okay, well, I'm extremely thankful to you for your participation and your precious advices to the nursing industry and overall the healthcare industry, including the policymakers. And I'm hopeful that the policymakers pay heed to all these concerns and try to come up with a possible solution that can be better for the healthcare industry, and it can be beneficial for the patients. And if it is beneficial for the patients, then definitely it is better for the entire nation. So, Mahikamil, is there anything that I have missed during the conversation? Please point that out. So, and if there is any final message that you want to convey to the viewers, so please you can convey that final message, and you can also share anything which I have may forgotten to ask you and is important for this conversation.
Um, okay. Actually, whenever we sit and talk about the challenges being faced by nurses or nursing in Pakistan, there can be very lengthy debate. But these were the main points, and of course, there are many points which are left. But I would like to highlight a concern here, which is prevalent these days. I don't know, have you observed it or not, but there is a stream of new nursing colleges these days, and in every town there is a nursing college being opened by any millionaire or any person who owns the place or the space. He constructs or takes the building for a nursing college, and a nursing college is made, and then there are um, connections made to the people who are uh, nurses, and especially those people are found out who are doing government jobs, and they are hired that you just have to come for the inspection and you will get the money, and we will get accredited by the Pakistan Nursing Council, because Pakistan Nursing Council has strange kind of rules. It demands that there should be um, everything done before the accreditation. I mean, how is it possible that if there are no students in the institute, then what would teachers be doing there? But it is the policy, and the new colleges have to follow this policy. So the college owners or the principal, whatever, they look for the people who are available, who are not registered with any nursing college, or who are doing government jobs somewhere else like nurses, and they hire them just for the inspection, and they pay some money to them for the inspection, and then the college gets accredited. And after that, who is responsible after that? When there are admissions in that nursing college, they won't be having the faculty to teach them. So who would be responsible for the education to them? So the nursing colleges are like mushrooms growing these days. So this is a very important point to ponder on, and I would request anyone, if anyone is any nurse, especially in Pakistan, is listening to me, please don't fall into this trap. This is a shortcut, and this is not ethical. This is highly immoral, that you are getting money for just by inspection, and you are telling people that you are working here, and in fact you are not working there. You are just going for the inspection. So uh, actually the nurses who will be listening to me would get this idea about what I am talking. um, but to the new students, I have a piece of advice that always look for the university accreditation or university to which the college belongs. in which you are taking admission, or try to take admission in a big university or institute which is some kind of uh, working from the past 5 or 6 or even 10 years, because the new nursing colleges are not reliable. You also go for the faculty, also check who is teaching there, and if they are having the capability to teach, they are eligible to teach there. Because in a nursing college, teaching graduate students, there should be 2 or 3 MSN instructors and assistant professors and professors and people like that. So in the end, last but not the least, I would like to leave a message that nurses should try to study, try to do more researches, and they should make themselves strengthened. And because they are the backbone of hospitals, I previously said that if doctors are the brain of hospital, then nurses are the heart of hospital. If brain stops working, heart still keeps working. So but when heart stops working, nothing works. So uh, to make nurses work, policymakers should pay ponder on their demands, their salary needs, their um, other needs like career satisfaction and shift management and budget management and things like that. So if there are few people like the dean of Aga Khan University or Shifa International Hospital, or few people who are positively working for the betterment of nursing, and I look forward and hope that the image of nursing will be changed in future, inshallah, and more nurses will come up with positive uh, positive aspects of nursing. Thank you so much, Asad, for having me. I look forward for more such sessions.
Oh, my mic was mute. Okay, as you just mentioned, that there are some few points left that you have to discuss related to nursing. So, is there anything else that you want to discuss or mention or highlight anything?
I think we'll plan a separate session for that, because there are many things left. We can have a separate session on it.
Okay, that's okay. So, all the viewers who there might be some viewers who might be thinking that it is a repetition of the same discussion that we had a few days ago, but that was in Urdu language, especially for the local viewers and especially for the nurses who are trying to make it big in the industry and who are leaving the country because of brain drain or the work pressure that they have to face or the negative reputation that they have to endure. So this conversation in English was for more viewers because English is a language that is spoken around the world. So this conversation helps us to convey our message to uh, different nurses and healthcare institutions around the world, and we are also hopeful that our voice reaches those nurses who have left the country and they have gone abroad. So, inshallah, we will be back with more discussions related to nursing. And this is Miss Mah-e-Kamil Hashmi, a nursing instructor. As soon as she comes up with more topics related to nursing, which she thinks are important and they need to be highlighted and they need to be rectified, we will be back soon. Thank you for your time, Mah-e-Kamil Hashmi, and thank you to all the viewers for your precious time. Thank you. Allah Hafiz.